There's a number of products that SATA has that can really help with arthritis. And rather than talking about the theory of what can be done, let's talk about what SATA products can be used to really help people with arthritis tonight or tomorrow.
If you're looking for, the one thing that I love that Amy was talking about was the topicals, because the topical is going to be your fastest relief, and especially in the moment. Most of us are dictated by that breakthrough, like the pain is so intense, so you're just looking for anything that will help out. So we have that infused balm. It's called the Fix. It is wonderful, just wonderful goodness. It's got like an icy hot type of experience to it, and you can put it on your joints, you can put it on pressure points. I love putting it on my neck. I think you had touched on that too, Marc. My husband gets cramps in his legs because he doesn't like to eat fruit and things like that. So it's wonderful. At night I put it right on his legs, and he doesn't end up waking up in the middle of the night with the cramps. Our tinctures, I think someone in here put something about the Soothe tincture that they're going to be taking. Soothe is quite possibly one of my favorites ever. It's a 1-to-1. It's an equal balance CBD and THC. So it helps out with pain relief. It helps out with inflammation. It's like this liquid gold of goodness. It's great for sleep. I just can't say enough about it. But we have that calm as well. So if you're not wanting to use anything, like Soothe is, we consider that like an introduction to the psychoactivity or the euphoric effects of the THC. So it's a really mild experience. Calm is a high CBD, no psychoactive experience with that at all. But it is also a wonderful reduction for your body, especially when you take it daily, especially when you have that balance in there of it. Zen, I love Zen for like yoga. That's a 1-to-4. Got a little bit more THC psychoactivity experience in it. But again, the terpenes in there are just such a master of ceremonies. It's great for creative flow, gentle exercising, stretching.
Daniela, it is great to have a cold while you're trying to do this. I should point out that a number of these products from SATA, if you notice the ratio products, you're looking at products that are either high in CBD or basically 1-to-1 THC products. And then, of course, if you have a tolerance for THC, the Zen product, 1-to-4, is something that works very well, not only for inflammation, but also for pain. This Zen product is what I use to relieve a lot of the pain that I have. I have inflammation in my neck from an auto accident from years ago. And it's something that's really interesting in that it comes not only just in the tinctures, but also in vape pens, oils, pods, and Theragels. Theragels are something you can put in your mouth and let them just basically dissolve, and it really gives you relief almost instantly within 3 to 5 minutes if you're using that particular product. It's very, very effective. So here's some products that you can pick up from SATA. And again, here in Florida, there's a number of, I think there's 35 dispensaries that are out there. The most important key, if you're looking at medical cannabis, is take a look at the recommended terpenes. Because if you take a look at products that have caryophyllene, myrcene, linalool, and terpenoline, these are products that will help you with your arthritis, both as well as the inflammation and for the pain. So when you're going into a dispensary and you're looking for a product that can help you, don't talk about a strain, talk about the terpenes that you're looking for. Tell them you have arthritis, here's the terpenes you're looking for, and they'll tell you the products that they have that can work, and also the routes of administration or how to take it. The terpenes and the recommended terpenes, not only from SATA, but other dispensaries obviously have these as well. What we're trying to do is give you a guide to help you get products tomorrow that can help you with your arthritis. Let's jump into a few questions that we had just prior to the webinar. But you're going to get an email as a follow-up to this webinar that'll give you a link to the video. It'll give you a copy of the presentation. It'll give you information on different slides that you see, like the terpene tables, things like that. So you should get a bevy of information to help you after this really go forward. What is the best way to consume cannabis for arthritis? Well, this particular question is not just for arthritis, but it's also for any way of using medical cannabis. And my answer that I usually give is, what's the most comfortable for you to use? There are people that like smoking or vaping. There are people that don't. There are people that like edibles. for example, like gummies, brownies, chocolates, things like that. There are people that don't. I suggest using a version or a route of administration that you're comfortable with and that you will use. Don't use something that's really foreign to you or something that you're going to force yourself to use. For arthritis, something that works with inflammation. It's something that's really critical to reducing your pain and as well as the symptoms from arthritis. Normally, I recommend people start with tincture drops because you can easily figure out your dosing regime. But also, I think the edibles will help quite a bit because what happens is the edibles will actually cause a longer effect, meaning they last, as we showed in the slide, anywhere between 4 to 10 hours. So you're going to get a longer period of relief. Now, the thing about an edible is be cool, because about the time you start think it's not working and you take another one is about the time it's going to start working. Again, if you're into smoking cannabis and this is what you really want to do, I'm recommending either a concentrate, a vape pen, and or if you want to smoke flower, a dryer vaporizer. You'll find that you'll get a lot of benefits from that rather than just smoking a joint by itself. A lot of the benefits meaning your cannabis will last longer, you'll buy less of it, you'll get more effect from it, and it'll give you better medical efficacy. Let's jump to the next question. It says, I have stage 3 arthritis and I'm in my 50s. What would you recommend for pain during the day while working? I have arthritis in my knees from, candidly, from knee surgery. I have both knee replacements. Welcome to being a senior citizen. And then also I have arthritis in my neck from auto accident. I have 7 herniated discs that left me with quite a bit of pain. Most of the injury is being caused by inflammation. So when you ask, what do you recommend? During the day, I recommend products that are either high in CBD or one-to-one products. What you really want to do is you don't want to be high during the day. You really want to keep this where you're lucid. And depending on your sweet spot, how much your tolerance is to CBD or to THC, you probably want to stay something with a high CBD, low THC, or something that's within the range of your sweet spot. So when you're asking for recommendations, recommended tincture drops. I would recommend actually a topical, which would work great. I have arthritis in one of my hands, and I use the balm that Daniela was talking about. It works wonderfully, and it helps quite a bit. So something that you may want to take a look at as going forward is the topicals, the tinctures, and then, of course, if you're into the smoking side, you may want to take a look at that because what it does is it works almost immediately. Let's go to the third question. It says, please address triple compartmental arthritis in knees. Where do I start? I'm not familiar with the term triple compartment. I have had a terrible time with arthritis in my knees over the years for decades. And in talking to a number of the doctors that I work with, the question is, where do I start? The answer is get rid of or try to reduce the amount of inflammation as possible. Also, be careful because in certain cases in the knees, like for example, I was an athlete and for many years just basically abused my knees. I lost a lot of my cartilage and I was basically bone on bone, which is a very painful exercise. It did create arthritis, but really it turned into something that was worse than that, hence why the knee surgeries. But what I really suggest starting with is start with the tincture drops, go after the inflammation. You'll find that when you relieve the inflammation, it will relieve the pain. And that's really the key that you're really looking at. Don't overlook topicals. They work great. They may only work for 1 to 2 hours, but they really, really work. And it's something that helps you get rid of that pain almost immediately. Next question is a good, interesting one. Temperature sensitivity when cold weather comes in for RA patients and others. How do I handle flare-ups, especially those caused by weather changes? It is interesting. You're almost with arthritis, and you're almost like a weather vane. You can tell when the cold weather's coming. You can tell when cold weather's on the horizon, things that are there. I would start with topicals with that area. I would look at tincture drops. That's something that's there. And then if you're looking at more like how do it last during the day, and you have a higher tolerance for THC, you may want to take a look at an edible, something like a Wana edible or something like that is high in, that has a lot of terpenes in them, and that hopefully will help quite a bit. I'm not trying to push a lot of the vape products because in this particular case, we're really looking at inflammation. Vape products work very effectively, but I do think that there's a lot of good tincture products. There's a lot of good topicals that'll help you address the inflammation, which is really the culprit that we're really trying to put in a cage and handle. What is recommended for severe rheumatoid arthritis in the working hands? I do manual labor daily. Topical or oral, please? How about topical and oral? I recommend both of them. If you have severe arthritis in your hands, My godmother did. She had arthritis to the point where she could almost not open her hands. And so we got to a point where what I did was I worked with her on a topical cream that helped her be able to get leave a lot of the pain. And we used the tincture drops morning, in the middle of the day, and in the evening. We used the 1-to-1 to be able to help her manage the pain during the day, because the arthritis is not going to go away. If you take it in the morning and you don't take it in the evening, the arthritis will come back and you'll begin to feel a little bit of that pain. You don't necessarily need to take a full dose of the orals, meaning the tinctures, because you are using the topicals. You may want to temper that down a little bit, but it's something that you may want to play with as far as the amount of dosage to find out what your sweet spot is. Use both. And by using the 1-to-1, most people are fairly tolerant to THC in a 1-to-1 form. It should help you during the day and not cause too many. Is medical marijuana useful in slowing the progression of arthritis and its degenerative effects? Yes, it'll slow the progress, because what it's doing is it's managing the inflammation. And the inflammation, as it gets worse, causes the pain to get worse, which really opens the door for arthritis to really take over the joint. And really, when you talk about the degenerative effects, if you can control that inflammation, it's going to stop that degenerative effect. However, please make sure that you're using a CBD and THC product for this, not CBD by itself, because you're going to need to trigger with the THC the medical benefits that help with the address the degenerative effects, and also really help some of the pain that's really there. How do I use marijuana for our rheumatoid arthritis in the spine? Well, first of all, I would use exactly what I was mentioning earlier, which is using it. I would use the tincture drops to be able to help the whole body be able to address the arthritis, the inflammation that the arthritis is causing on, especially in the spine. What you might want to do is have someone, a partner or somebody, rub some of that, the topicals on. The topicals work very well. They get right into that spine, and they'll help quite a bit. It's something that you really want to be able to address. They'll work within 5 minutes, and they'll typically last for an hour or two. The tincture drops will last 4 to 6 hours and will give you that morning, afternoon, or evening relief that you're really looking for. A related topic to this particular question is he's had both hips replaced, lower back L4 and L5 fused, pelvis refused, recommended for medication. My recommendations are going to be topicals and tinctures. And again, we talked about the different types of products. Every person is different, and you're going to find that you may react different to THC than I react, or some other people react. You really got to find out what your tolerance is. Start with a 1-to-1, then increase the amount of THC in the product. Go to maybe a 4 CBD to 1 THC. Maybe even the Calm product, which is a 12-to-1 product. So what I'm trying to point out is lean towards the inflammation side, lean towards the CBD side, and it may help you quite a bit. Every person is different. You might want to try a 1-to-1. You might try a 1-to-4, especially if you have a lot of pain. It might be able to help you with that. I use a lot of the 1-to-4 products, especially to be able to help with the pain, because I can get a lot of, with 7 herniated discs in my neck, I get a lot of pain very, very quickly. Next question is, I have cancer, fibromyalgia, arthritis, and migraines. How do I treat them all at once? We mentioned earlier about the endocannabinoid system, how your body regulates itself to put yourself in what they call balance. Your body knows. The minute it sees that problem, it tries to produce the endocannabinoids to address those. But again, if you're a senior citizen or you have a number of conditions like this, you're going to need to supplement your body with some additional cannabinoids from the phytocannabinoids from the plant to be able to give your body the resources it needs to be able to address those particular issues. So the answer is, cannabis will do this. Your endocannabinoid system will take over and know where your problems are. But again, give them, in many cases, CBD and THC that it needs. Now, we've done webinars and videos on cancer, fibromyalgia. We're doing this on arthritis. We will be doing we have some we've done in the past on migraines. We'll be doing them over the next quarter. So there are some very specific webinars on these particular individual ones. But when you put them all together, the answer that I can give you is let your endocannabinoid system do the job it's designed for. Give it the resources it needs. Start with a 1-to-1, and then candidly kind of increase the amount of CBD. Maybe go to a 4 CBD to 1 THC. See how that works. That'll help quite a bit with the migraines and also with the arthritis. When it comes to cancer, however, this is a different animal. This is something that's a growth inside your body that has to be controlled. FSO product is a whole plant product. This will do a lot to address and to help contain and to manage your cancer. It's not going to get rid of it potentially. We're still realizing that it does in certain cases put you in remission. There are types out there that really isn't very effective with. So we've got to really do some experimentation for you personally. Can topicals, lotions, or gels be effective for treating chronic lower back pain caused by arthritis and stenosis? Yes. I can't tell you about lower back pain from sports injuries. I've had some of that, but most of my is most higher back pain, which is from the herniated discs in the neck. Topicals are wonderful. We put them on, they work right away. I know that there's, as a senior citizen, I'm supposed to be relaxed and sitting on a couch. I don't. I'm in martial arts quite a bit. And I do come home sometimes with having really stressed my knees, going in and using, the topicals. I recommend topicals, using it with some other route of administration, like a gummy or a brownie. Not only just get rid of the pain, but have it stay that way for. Next question is, how the heck can I choose the best marijuana for arthritis? I think I know what terpenes I need. I can't find the info on each strain. Strains are important, but all they are is carriers of the terpenes. It's the terpenes that do all the heavy lifting, and it's the terpenes that really help you address the inflammation and the pain and the medical condition. Strains are the cannabinoids that are being used, but what's interesting is today, most dispensaries are developing these products for a particular condition. They basically call those cultivars. And a cultivar is a combination of terpenes and also strains. I think we gave you a chart in the presentation that showed you the different strains that you can take a look at that have the terpenes in there. But pay attention to the myrcene, the caryophyllines, the terpenolenes, the linalols, and then have the strains match that terpene profile. Relief that you're looking for is from terpenes and not necessarily from strains.
Are curious about any of the strains at SATA, I can say for sure, you can always request a certificate of analysis, or what we call a COA. You can do that in store. Any person working in store can provide that for you, and also through our care center, so that you'll be able to find the exact terpenes per whatever strain you're interested in.
And something that relates not only to this question, Daniela, but also the next question, at SATA, you do consultations. In other words, somebody can walk through the door of your dispensary and say, look, I'd like to have a consultation to talk about my particular condition that works best for me. And they'll really highlight the terpenes and the products that can help. Is that correct?
Absolutely. We are huge on education. So never feel like you are bothering us or taking time out of our day. That's what we're here for. We really pride ourselves on empowering you with the education on how to take your own health in your own hands. And with this webinar, it's just a beautiful little hand-in-hand partnership.
Right. And it helps answer the question of what can I take and what's the correct dosage. You'll help work people through really finding their sweet spot.
Yep, exactly. We have charts and diagrams and things, so you will go home with all of the information that you need.
Great. Look at the terpene profiles. It'll give you the routes of administration that you're comfortable with. And again, I would recommend, don't be shy. Ask for a consultation. It's something that you'll be shocked at how it really helps you. Whether you're a new user or you've been using cannabis for a long time, a consultation can't hurt. You'll be amazed how many things have changed and what's new that can help you. Okay, so next question is, Americans Disability Act. Patients who use prescription medication often discriminated against for using their medication. However, courts have found the ADA protections do not apply to medical cannabis, so it is federally illegal. That is exactly the case. We are stuck in the United States with cannabis being categorized as a Schedule I drug, which says it has no medical benefit, according to our federal government. This is the same federal government that in 2003 applied and got a patent on medical cannabis. This is the same federal government that has been funding research into medical cannabis since 1964. Dr. Raphael Mechoulam was the main recipient for a lot of this. Ben Gurion University and the University of Jerusalem gets a lot of the resources and still are being funded today. Interestingly enough, although on one side they say it has no medical use, on the other side they're showing that it does. And you're right, we don't get a lot of protections with medical cannabis. Our states should provide protections for us. They're not doing that job. MPP, the Marijuana Policy Protection Act, plus as well as, or project, excuse me, plus Normal and a few other folks really do a good job of lobbying to try to really represent us in this particular case. Next question is, I have Sjogren's, thank you very much for the pronunciation, syndrome and fibromyalgia. How can medical marijuana help and what works best? Well, what's interesting is in many cases, in both of these cases, you're trying to identify something that's related to your endocannabinoid system trying to do its body and put it back into homeostasis. A lot of it has to do with when you talk about arthritis, lupus, things like that, this is where the CB1 and CB2 receptors really do their job in the endocannabinoid system. The answer to your question is pay attention to high ratio CBD-based products, and also pay attention to products that do have THC in them, because that'll help you with the pain. This is especially true for things like rheumatoid arthritis and lupus. Now, in the cases where you're getting dry eyes, dry mouth, and things like that, again, we showed you a chart on CBD working with different receptors in your body. They will help with some of that, but it's not going to completely control that. You still have your medical doctor can give you certain medications to address those particular symptoms directly. So I'd be a combination of using a high CBD based product with THC, and then also working with your doctor for all the different what I call the different side effects that are unwanted, things like the dry eyes and things like that. Any comments on that, Danielle?
No, I actually completely agree. The dry eyes and dry mouth are usually myrcene related, what we're seeing. So for me, it's just the smallest little thing that I have to deal with in order to have some pain relief. But I do understand that for you, that it can be intense and a different experience. So like Marc was saying, definitely do a high CBD ratio product. You want the THC in there. Your myrcene is what's going to create that dry eyes and dry mouth. So look for the products that that's gonna be a lower in the Zen. That's gonna be a lower terpene there. So you're having limonene and caryophyllene as your dominant terpenes. So that'll help with all of your symptoms, and it won't give you as much dry eyes and dry mouth. But like Marc said, sometimes that's just part of it.
Yeah, and also if it really is bothersome thing, which I understand it could be, talk to your medical doctor. They can give you things for your eyes and also for the dry mouth. Using the last half of carts burnt my throat and make me cough and awake in 15 minutes after use. Is there a way to get around this? Do you have any thoughts on this, Danielle?
Yep, totally do. So typically that's going to be a distillate cartridge that creates that. And you get to the bottom of that and you have a ton of terpene residue. So that's what's creating that, the tickling of the cilia in your lungs and making you cough there. I suggest checking out a full spectrum cartridge and seeing how that feels. Also check the heat on your battery. You don't want that too high. That can blow through your oil and make it very harsh when you're using it.
Right. I think a lot of times when I see people have this problem, they have a cartridge that you can't adjust the temperature on. The temperature is usually about 390 degrees, which can cause this particular problem with some of the terpenes. I recommend getting a cartridge that you have a button that you can set a low, medium, and high setting. And typically I use the low and the medium settings because that's where I get the maximum benefits.
I completely agree. A variable power battery is definitely the type of battery you want to have. The breath activated batteries, they're convenient for some because you don't have to push a button. For some people that have a palsy or any tremors, that can be a little bit of an issue for. But if you're able to press that button and inhale while you're holding the button down, it's going to be a much better experience, and definitely lower it down. I like what Marc said about using one and then bumping it up to two. I usually tell many of our patients that come in to bump it up to two when they get to the bottom, because that'll help that terpene residue to just implement with the remaining cannabis. When you get up to three, it's just or higher, it's just too high. It burns those terpenes. So think of like burning butter or oil in a pan. That's essentially what it's doing. So it's making it just really harsh on you.
You have a great cartridge at SATA. I think it has straight temperature settings, and you had it on sale. I think I bought it one time for like $9. I think it's usually about $20. Is that right?
We have two different batteries. The one with the variable power, they're both $10, but the variable power is the $10 one. I'm not sure which. You might be talking about the drop-in silo, little black device that you can drop it in. Those are really nice. They're also great to carry in your pocket, but they are not a variable power. The cartridges we have are the distillate cartridges and the full spectrum cartridges. And with promos, you can pay, the same price for either one, just paying attention to what the promos are.
Let's jump on to the next question. Balms and lotions are touted as effective in pain relief. If so, what kind is most effective, as both are costly? How long do different topicals last? There really comes as balms and lotions. Do you want to talk about the difference between them, Danielle?
Sure. So the balm is going to be more like a salve consistency. It has that icy hot type of experience. It sticks to the skin. It lasts a little bit longer. Your lotion is very much thinner than the balm, and it's a standard lotion type consistency, but you have to reapply that often. That's not something that's going to hang on for a couple of hours. That's something you're going to need to reapply. And I would say that we use that or suggest that more for skin issues, more for it just doesn't penetrate as well as the balm does into getting into your joints.
I think it's a personal preference. I prefer the balm over the lotion. Let's jump to the next question. It says, I have diastolic heart failure and I like to smoke for relaxing and stress relief. What grade flower should I use to get longevity? But I would say the first thing I would do is look at a dry herb vaporizer. If you like to smoke, use a dry herb vaporizer. It's going to be easier on your lungs, easier on your body, and you're going to be able to dial in that terpene profile. Now, I will be the first one to admit that dry herb vaporizers are not cheap. A good one does cost some money, and I'm really glad that I bought it, because when I use it, it's something that I use almost every week, and it's so if you use it all the time, it pays for itself. But I really recommend a dry herb vaporizer. In this particular case, it'll help you quite a bit. Now, as far as the grade of flower, I think it really depends on the terpenes. Do you want to talk about that, Danielle?
Yep, agreed. And I like what you said about the dry herb vaporizer, because that's just going to be more healthy aspect, especially for your heart failure that you're dealing with. As far as the grade of flower, and you're just wanting to smoke or relax, it's definitely going to be terpene dictated. Like, again, those are the master ceremony of what your experience. I mean, don't discount lower THC flower, because that little microdose, if you will, is really beautiful, especially in a dry herb vaporizer. That's something you can use, without being couch locked or anything like that.
Yeah, sometimes there's tier 1s, tier 2s, and tier
Gotcha.
3s that you see that are out there.
Gotcha. So when you're at your dispensary, you just ask them why is it different grade? Like ours, we have an indoor premium that's grown all indoors. It's everything that in the world is controlled to make that happen, to grow that THC. Everything is controlled. We also have sunshine flower. It's called Florida Depth. It's grown in the sunshine. Sometimes it's in a greenhouse, but it's really up to Mother Nature, so there is differences there. It's more pinpointed with the indoor premium. It's more dialed in and terpene focused with the Florida Depth, or things that are grown outside. Those are just going to be more natural.
So for the consistency, if you're looking for something that you want consistency, and that you can get the, it works almost every time, I'd recommend that the one that you say grown indoors is the one you're looking for, right?
Exactly, because that one, again, is more controlled. So that when you get this, now again, it's terpene dictated. So you'll want to ask for your COAs too, your certificate of analysis, because like a 2% terpene animalary is going to pale in comparison to a 4% terpene animalary. That's definitely something to look at. But your outdoor flower is always going to be different. Every time you get it, it's going to be different. It's going to have similar effect, but it's not going to be the same. Where your indoor premium is going to be more consistent, like you were saying.
Okay, let's jump into the next question. What strains are best for psoriatic arthritis, and also what is best for day versus night use? Let me step away from the word strains. Let's go to the words terpenes. Pay attention to those 4 terpenes that we kept telling you about. And again, this is your myrcene, your beta-caryophyllene, your terpenolenes, and your linolols. These are going to help you get yourself a product that has those terpenes in them. Now, what's best for day and for night? Candidly, during the day, you want to stay lucid. You want to be able to be, you want to be able to do, to work, to be able to talk to your friends and things like that. So I'd say staying with a high CBD, low THC product will help you be able to do that. In the evening, you may want to take a look at a higher THC product, especially if it helps you get some sleep. Now, I do have to tell you, I take a square or two of chocolate before bed every night for two reasons. One is it helps me sleep through the night because it lasts for 8 to 10 hours. And the second is it helps me fall asleep. I usually take it an hour or two before I go to bed, and it helps me get a good night's sleep. That's something you may want to take a look at. Now, I wouldn't do that during the day because when I take those, it does put me to sleep. So really, in that particular case, I'm using a higher THC versus CBD product in the evenings, and I reverse that trend during the day. Your thoughts on that, Danielle?
I agree completely. I agree 100%. Your terpenes are just going to dictate everything. I like gummies too. So
Yeah, there's nothing wrong with gummies. I'm a chocoholic, but you're right. My wife loves gummies. Next question is, should I be looking for, in terms of CBD to THC ratios? Not all dispensaries provide different ratios. You have hit the nail on the head. One of the things that just drives me crazy in this industry is when I deal with dispensaries that don't have ratio products, or the ratio products they have are made from isolates that don't have terpenes in them. Really, you're looking for that medical relief. You're not just trying to buy a product. And I think this is where you need to pay attention to the COAs. I would only work with and buy from dispensaries that have terpenes in their tinctures and that have the COAs that show the terpene profiles that are out there. Now, as far as the terms of the ratios, this is really something I can't answer. You have to do it yourself. Your body will tell you what works best. Now, we do know that a higher CBD ratio to THC helps with inflammation, will not cause you to get that psychoactive effect. Danielle mentioned earlier, start with that 1-to-1 ratio and then experiment with that. Try a little more CBD, try a higher CBD to THC ratio, and you might want to try the opposite, see how that works. Your thoughts on that, Danielle?
agreed 100%. Your CBD ratio is just everything. I don't necessarily talk about other dispensaries. I know there's quite a few out there that are very medicinally focused. So just check around, check their websites out, call their call center, get your questions answered. You can, like I said, you can always come into Certera. We will set some time aside for you as much as you need and discuss all of your options.
And this is a good point where the consultation might be important in this particular case.
Agreed.
Let's jump into the next question that's out there. I've heard that there is a 1-hour frame after getting high on any THC product wherein you won't be able to sleep. Is that right? I've never heard of that. How about you, Danielle?
I've never heard of that, and I pretty much prove that wrong every evening.
Yeah, in fact, if anything, a lot of the high THC products put you to sleep, I think. That's one of the reasons why we kind of joke about people being in the couch. They're basically relaxed. I'm not aware of that, I guess is the best way of putting it. And I think that THC products will help you fall asleep, and he'll help you fall asleep within an hour. I know that when I take my chocolate, in my particular case, the chocolate takes about 30 minutes to work. I fall asleep within an hour, that's for sure. So let's run on to the next one. Will topical medical marijuana show up in a blood test? This is where there are two types that you have. There's a regular topical, and there's also transdermal. A transdermal topical will show up in a blood test. Is that right, Danielle?
Exactly. Yeah, because that goes systemic through the body, like you were saying. So it gets into the bloodstream. If you're just using your cream or your balm, that's not going to penetrate as deep. So you're a little safer with the cream or balm.
Right. I do have to tell you, though, that depending on the test that's done, it doesn't make any difference if you're using high CBD, low THC, or high THC, low CBD products. They'll all show up on a blood test if you have the right type, if the right kind of blood test is done. So a lot of people think they can get around it by using CBD product. They'll still show up. Word of caution. Next question is, why do creams and gels affect my stomach? I'm disabled, 40 operations, EDS, flour, and vapes are fine. I find this interesting because I don't believe a cream should affect the stomach. The gels I understand because the gels are being put into your body, and what they're trying to do is they're trying to absorb that. Like if you take a Theragel or something like that. But I'm not aware of the creams being affecting the stomach. Your thoughts, Danielle?
Yeah, no, that's the first that I've heard of that. I've heard other people say that different terpenes affect their tummy, but I've never seen anyone say that a cream affects their tummy.
Right. I can see where the flour and the vape, you might want to take a look at tincture drops because they don't go into the stomach. They go into the lining of your mouth, and it gets absorbed into your bloodstream that way. Bypassing the stomach, that might be something that can help as well. Let's run on to the next question is, what is a good CBD dose to gain a therapeutic effect? Is there any combination of supplements that improve the effectiveness. Let me answer this in two different parts. Number one, I can't tell you what's going to help you. You've got to listen to your body. The best doctor, the best recommender is your body. Your body will tell you what's working, and your body will tell you what's not working. You got to find that therapeutic dosing level. Cannabis is no different than pharma drugs. It's no different from alcohol, no different from caffeine. Everybody has a different reaction. In the case of cannabis, you have the ability to go from a quarter of an eyedropper to a half an eyedropper to go maybe to the whole eyedropper. You can control your dosing level. Take a day or two, find out how it works. But I can't emphasize more. Starting low, going slow, and find out your therapeutic dosing level. You'll be able to find that really within a week or two. You'll be able to know exactly what's there. And when you find it, believe me, you sit there. The first time I was going through that and it started relieving the pain in my neck, literally, it was like, whoa, this works. I'm into this. I don't have any negative side effects. I wasn't high. I wasn't drowsy or anything like that. So it's something to pay attention to. Now, the question is, are there a combination of supplements that improve effectiveness? Danielle, doesn't cannabis like fats? Cannabis likes food.
Cannabis loves food and fats, especially, and it'll bind to any of that fat. When you're like, some people have issues with the onset of edibles, and that's what we usually tell them. Take it with something fatty. It'll just stick to that fat and go through your body. Avocado oil is a good one. Any of your oils that are healthy like that. Even nuts, peanut butter, that kind of thing.
Yeah, you're working that with cannabis really helps quite a bit. Desserts are great. Desserts are your best friend of cannabis.
Amy had touched on, keeping a journal. And with this, like, you need a journal. You need a journal to figure this out. And it'll be situational sometimes. It'll be environmental sometimes. So definitely take notes.
Yeah. I know that when I had my knee operation, I had my left knee replaced. But I just started taking notes in the evenings as to what was going on, just to kind of it's kind of done it for myself. And what I found after about a month and a half, I started seeing some very clear signs. One of the signs I saw was when I used a lot more CBD than THC, I felt a lot better. What I realized, and when I talked to my doctor about it, was by reducing the inflammation, I was reducing the pain. I thought if I just reduced the pain, it would go away. But if I didn't reduce the inflammation, it didn't go away. And so I found that the journaling became very effective for me. You don't necessarily need to write volumes of information. Just write down, I use this product, I use it at this time, and here's the effect. And after a couple of weeks, you'll begin to see some clear patterns that really start emerging. Next question is a good one. How do I sign up for a medical marijuana license? Here in Florida, I recommend the medical marijuana treatment clinics in Florida. Why? For three reasons. Number one is they have 25 locations. They're located throughout Florida, so that'll help quite a bit no matter where you're located. Number two is they're one of the few, in fact, I think you're the only doctor's offices that have a call center. The biggest problem with getting a card is I got my card, then what do I do? Where do I go? Where do I get this information? They sponsor this particular webinar, for example. Their objective is to give their patients as much information as possible. And they have a call center that really works to help you with your dosing. So you have support after you get your license. Most of the time when you go to a doctor and you get your card, he's so busy he can't answer your questions during the day. They have the support system that you need. And the third is MMTC has what they call a patient journey email system. So once you get your license, you'll get 1 to 2, in fact, you get 2 or more emails a month that'll actually walk you through the whole process of your medical cannabis journey. How do you get started? What kind of dosing information should you take? How do I handle edibles? How do I handle cooking with it? There's a whole bunch of range of information that you get. It's not a matter of just getting your card. It's a matter of what you do with it. And this is where I think MMTC has done a heads and tails job above everybody else in the industry to be able to provide the support you need to really help you get the best out of your medical cannabis journey. How can I attain a prescription for medical marijuana, PTS, and arthritis? I cannot harp on this enough. There are no prescriptions. Your prescription comes from your body. Your doctors can't tell you the prescription level that you need for a lot of pharma drugs because they're based on weight. And in many cases, the weight doesn't necessarily accumulate to the metabolism of your body. Go through the dosing regimes. Now, we have webinars on dosing. We did one last week, and you can find it on our YouTube channel. Please watch it. It'll help you be able to figure out what products that you use. And I know this is perplexing because we're used to having a doctor hand us a prescription. In this particular case, you're in control, and this will help you not just with PTS and not just with arthritis, but really for chronic pain or anything else that you're looking for. for.
I agree 1000%. I love how you're saying how the body dictates what you need. And that's the key right there.
And again, MMTC helps with that. I can't emphasize enough. The support after you get your card is really, really critical. Okay, next question is, what's the difference between medical marijuana and NSAIDs? The primary difference is medical cannabis is providing a product, the phytocannabinoids, that are completely compatible with your body. They are not a foreign drug or a foreign substance in your body. Pharma drugs are, in fact, something that's foreign to your body and can cause a number of negative reactions. I would say the best way of understanding the difference is, one is natural, working with the natural components of your body to help you get the relief you need. One is a foreign substance that's trying to target one particular part of your body, but doesn't necessarily address the overall effect and doesn't have the capability to tap into the endocannabinoid system.
Yeah, with NSAIDs, those are just over-the-counter anti-inflammatories. They're effective, but they're not going to create that homeostasis that your body needs to eliminate your inflammation.
Next question is a really good one. Does marijuana help with complex regional pain syndrome? Yes. I work with a number of pain doctors in a number of different areas. In fact, I was meeting with one of them today, and we talked about how effective cannabis is for pain. The answer is yes. But again, you're going to have to go back to finding out what your sweet spot is. It's not a matter of just grabbing a cannabis product. And again, with pain, there's a terpene profile that you really want to take a look at. I would go and do a consultation with a SATA dispensary. They'll help you identify the terpenes that you need, the product that you need, and it is very, very effective for pain. In fact, one other doctor that I was meeting, not the doctor I met with today, but he was mentioning that the most effective pain relief medication he has found has been cannabis, and he was just upset that he wasn't taught this in medical school.
Yeah, we treat people with intense chronic pain every day, every single day. People that were in car and motorcycle accidents, that the testimonies I have on pain relief is why I'm here.
Next question is, 20 years I have used cannabis to combat pain. It does not work that well anymore. What to do supplements? Well, I think there's something that is important to point out here. If you've been using it for 20 years, the question I ask is, have you done a cannabis holiday? One of the things about using medical cannabis is every 4 to 6 weeks, you should take a day. In fact, they recommend 4 days, but you should take at least a day to maybe a day and a half off. Stop using it. Here's what happens. If you're giving your body cannabinoids, phytocannabinoids, your body stops producing endocannabinoids to the level it should be. In other words, it gets lazy. By taking a holiday, your body says, wait a minute, I'm not getting these cannabinoids from the outside world. I've got to go back to work. It re-triggers your endocannabinoid system. It helps your receptors reset. And it's really something that's very effective. I've got about a day that I can take a holiday, maybe stretch it to a day and a half. And at that particular point, my neck taps me on the shoulder and says, buddy, if you don't do something pretty quick, you're going to start feeling it. So I take about a day, like I say, every 4 to 6 weeks. It helps me not only helps my body reset, but it also helps me be able to use less cannabis products.
Definitely switching it up, definitely doing an endocannabinoid reset is what we refer to that as. And I would wait until it's not affecting. You don't have to constantly do a reset. Just wait till you've created a tolerance to where you're not getting the relief anymore, and then do your reset. You'll be able to tell when that is approaching. You'll start to feel the decline of it, and that's the perfect time to do it.
Good question. The next one is a really good question. It says, are there any additional recommendations for gout flare-up? I have a good friend of mine that has gout, and what we really have found is CBD is extremely effective for that, because really the gout flare-ups really cause a lot of the inflammation, which causes a lot of pain that's really there. I found it to be fairly effective. The problem is I haven't found a lot of studies on this. So I wish I could cite some medical studies on this. I really don't see that many of them. But I do know that in my particular case, working with a couple of patients, one of them a good friend, we found that CBD helps.
CBD would be my absolute go-to, especially like a CBD gummy. So you have a little longer active. My dad gets gout really bad, and he's tried all the holistic remedies, and CBD is the only thing that takes the cane away. He's got a cane when he's on gout, and that's what he's like. He always says, CBD takes my cane away. I definitely recommend that, something a little long lasting.
Next question is there a topical with just THC for pain, no CBD? First, I'm going to ask, why no CBD? CBD and THC working together, really 1-to-1 is 3. It causes it to be a lot more effective. And so if you're trying to relieve pain and you want efficacy, you're going to want some CBD in that product. Now, that doesn't mean it's a 1-to-1. someone, you may want to have a high THC to CBD product. I understand that, but no CBD is not the way to go in my recommendation, because there's going to be a lot of negative side effects, and also you're not going to be getting the best out of your product, and it may not be as effective.
I definitely agree that it's not going to be as effective. You will get some effectiveness from the THC, but without that CBD, you don't have that magical goodness. Most pain comes from inflammation, so you need that CBD in there.
I'm not aware of, I'm sure there are topicals that are just THC. I'm not aware of them. Most of the topicals that I work with that I'm aware of have a little bit of CBD, if not an equal amount of CBD to THC, because of the fact that they work together so effectively. Pay attention. What you want is relief from pain. Don't get rid of the CBD. CBD, again, it's a little bit of CBD. You don't need a lot of it. We're going to announce some of the questions that have been asked live during the webinar. Janice asked, I have OA, osteoarthritis, and I tried topical creams and had an immediate allergic reaction to a small amount on my thumb joint, and my whole hand started turning red and actually went up 30% on my arm. Do you think it's from the additives or CBD itself? First of all, I'm sorry you had that negative reaction, but I'm glad that you tried a little bit of it. That's really the key, is to try, anytime you have anything that's topical, try a little bit to make sure that it's not there. I don't know how to answer that question. I think a lot of it, because I'm a pro cannabis person, I would say the additives might have something to do with it. But if you have tried CBD, like you've tried a tincture oil or something like that, and you haven't had that reaction, I would say it would probably come from the additive rather than the CBD itself.
I would say that's probably a lotion additive for sure, unless you already know that you have issues with something that might be in there, camphor, eucalyptus, something that might be in the product itself. I would definitely say it's one of the additives, but I've not studied that in particular, so I don't want to say 100% you're good, but definitely look into that. Maybe check with your doctor and see if you have any external allergies that you're just not aware of.
Yeah, and I think the easiest test is going to be try a CBD tincture. Try a 1-to-1 tincture, or try a tincture that has the CBD in it. If you don't get that negative reaction, you're going to know it's the additive. That's probably the easiest way to go to start off with. Maria asked a great question. It says, I was wanting to make my own balm. Which would you suggest to use? Concentrates, oils, or tinctures? I think this is where you maybe want to use an FSO oil. Is that correct?
Yeah, FSO is gonna be your yummy goodness right here. But you could also, we don't typically suggest shifting the product into something different. That's just something our company frowns upon, just in case there's any issue in the relaying of those instructions. But I make my own balm all of the time, and I use a Soothe distillate to do so. It's just going to be like what you're looking for. The FSO was made for topical. So you can totally use that. Just know that it's sticky and goopy. It's not, you're going to want a good oil to break that down.
Yeah, that's a good point. And the question is I think the key balms are probably the hardest thing to make, in my opinion, because you have to break down into something that's, let's just say, it's throughout the whole product, not just stuck in a particular area. But again, this is something you may want to take a look at. I'd lean towards the oils. The next question is, can you clarify what exactly does full spectrum mean when it comes to hemp and CBD? Full spectrum means you're getting all the terpenes and all the flavonoids. In other words, you're using the whole product. Can you clarify that for us, Danielle?
Yep, that's exactly right. It just means everything in that product comes from the cannabis plant. There's no additives, there's no botanical terpenes. Everything is coming from that cannabis plant.
I prefer full spectrum products because I'm getting the most out of the product, and especially when it comes to, you talked earlier about vapes. Full spectrum vapes are really the way to go. That can really help with a lot of different situations that are there. One other question is, why are some THC products psychoactive? I think we talked about earlier about the CB1 receptors really targeting THC, targeting the CB1 receptors. That has a lot to do with it, doesn't it, Danielle?
Absolutely. Absolutely. The higher the THC, the more psychoactivity you're going to have. Always have that CBD in there to help with your inflammation. And you can always use CBD to cut the THC psychoactivity as well. Say you get a high THC product and it's just a little too intense for you. Use your CBD to cut that. It'll bring you down.
I had a good question from Anonymous. It says, I'm taking SATA Soothe tincture CBD. Starting tomorrow, I'll be taking Humira for rheumatoid arthritis. Will the tincture reduce or affect affect the Humira, which suppresses the immune system? The answer is it does suppress a lot of your immune system. It really suppresses a lot of things in your body. The CBD will not react or counter much of what this product is doing. It should work with it. But again, I don't know of any studies that have been done between CBD and Humira, so I really can't answer this effectively.
What we see typically is that our CBD products are supporting or nourishing whatever regimen you're on pharmaceutically. So we don't see too many interactions with that or counterindications. We do see lowered blood pressure quite a bit.
Just do yourself a favor. Go to the website and read the negative side effects. It was very interesting to check that out. Anyway, let's run on to the next question. If someone that suffers from asthma would the vapes not hurt or make their asthma worse? First of all, let me back up and point out there have been inhalers that people have used. Forget cannabis world. People have used inhalers for a long time to help with asthma and to help people basically provide the relief it needs in the lungs. Cannabis can work the same way. In fact, there are a lot of there are some inhalers that are available on the market for cannabis, again, targeting asthma that's really out there. There's one thing to look at the inhalers type of thing. Cannabis has been effective with that. Now, as far as the vapes, it really depends on which vape that you're using, and I recommend using a full spectrum vape. But anytime you put anything into your lungs, and if you have a lung problem, it can aggravate it. So I just say I'd try it, but I'd be very careful with it.
No, I completely agree. And I definitely lean towards the full spectrum vapes if you're going to use that. And then back to that dryer vaporizer too.
Yeah, I can't tell you if it's going to make it worse because again, it's very body dependent. It depends on you and your how your body reacts to it. Steve asks a good question: is Dream tincture effective for arthritis?
Absolutely, but it is a high THC product. You know, that's a 1 to 9. It's formulated more for sleep, but you're going to get all of that inflammation or anti-inflammation benefits from it. If you don't want such a high THC experience, you know, knock it down a little bit, try the Zen or the Soothe. But absolutely, Dream is wonderful for all sorts of things, including arthritis.
Yeah, Dream, really the difference between Dream and your other 9-to-1 product is really the terpene profile.
Yep, it's just a quick little flip of a couple of terpenes. Relief is the other 1 to 9, and that one's formulated more for pain. So that might be what Steve is looking for, and the relief tincture as opposed to the Dream tincture. But then Steve asks a different question below that I don't know if we can tie into this one or go back.
Sure. Why don't you tie it in right now?
Okay. He's having that 1 hour effect with the 1-to-1 tincture. Can't sleep until it wears off. So that, in my opinion, is going to be a terpene situation. Something in the terpene profile is keeping you awake. It's acting more as a stimulant than which is really interesting because in the Soothe, what 1-to-1 tincture are you taking? Because we have 2. We have a Soothe and a Revive. So if you're taking the Revive, that's definitely going to keep you up. If it's going to be the Soothe, then I would say that's something in the terpene profile.
Right. I hope that helps. The terpene profile will be important, and you might find it different for each one. Now, Anonymous asks a question and says, I'm not clear which one works best for pain, CBD or THCH. I think what you really meant was THCA. I'm not overly familiar with THCH. There is a THCH out there, but it's not studied that much. I would say if you're looking for pain relief, really THC is a better way to go, but remember, a lot of pain comes from inflammation. If you relieve the inflammation, you relieve the pain. When I had my left knee replacement, I had a whole regime. I had a regime. What do I do in the morning? What do I do in the afternoon? What do I do at night? And what I found out was one night, in the middle of the night, at 2:00 in the morning, my knee was killing me. I'd run out of my high THC based product. I had a 4-to-1. I had a 1-to-4 product that I was using, and I ran out of it. And I thought this is not good. So I took a 1-to-1 product, a CBD product, and then I went to a Calm, which I took a 12-to-1 CBD product just to see what happens. And guess what happened? My pain went away. And I thought, this is crazy. I'm usually taking THC to go after pain, and the CBD got rid of the pain. Now, when I went and talked to my doctors, both my medical marijuana and my medical doctors, they both kind of looked at me and said, Marc, naturally, if you get rid of the inflammation, you get rid of the pain. So, Anonymous, I can't answer your question, which is going to be best, because if it's based on inflammation, like with rheumatoid arthritis, it's going to be a high CBD based product. You still have to have some THC in there. But if you're looking to just go after pain, like I did with my neck, I had a higher ratio product of THC to CBD, but I still had CBD in the product.
I completely agree with that, especially the answering it yourself. And know that sometimes CBD can take a little bit, it might not be effective today, but on Friday, like you take it today, you take it tomorrow. On Friday, you're like, ooh, my shoulder feels great. My neck is kind of loose and yummy. Know that CBD sometimes needs a little bit of a foundation or baseline to work with. Your terpenes are everything.
And I always tell my patients, if you're using CBD products, give it a week or two to really work. It takes a while for all your receptors because it has a lot of properties where it coats, it has neuroprotectant capabilities. It took a while for this condition to affect your body. Give it a little bit of time for it to work. So
Absolutely.
Danielle, we covered a lot of subjects. I know there's some resources that people can take a look at if they're looking at what I can do next. If you're looking for a card, we recommend the medical marijuana treatment clinics. Naturally, I recommend SATA, not just because you're sponsoring, which by the way, thank you very much, but I think also I like the fact they have consultations. I like the fact they have ratioed products, and I like the fact that they'll take the time to work with you. And I think one of the things that you mentioned is if your product's not working, you can bring it back. Is that right?
Yep, we have a hassle-free return policy. We can't actually take your product back, but we can provide you with a different product for the cost of whatever you're returning. So you're returning the Soothe and you want to try the Dream, we'll do an equal exchange for that.
Danielle, any final thoughts?
No, just thank you for your interest and good luck. Empower yourself with your own well-being.
Yeah, I think the important part to understand is you're in control. And I think that's important for a lot of people to understand. And also, it has worked. It is very effective. Next quarter, we'll have another series of webinars. We're going to start with, in the beginning of April, we're going to have a whole webinar on the endocannabinoid system. So you may want to join us for that. Have a good evening, and thank you, everybody, for joining us.